Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and try to make it a better system for all of us. Today's Martin Luther King Day in the United States in 2024. I'm going to be talking about ghost networks, but before I do that, let me give you a quote from Dr. King just to put everything in perspective. Of all forms of discrimination and inequalities, injustice in health is the most shocking and inhuman. Hold that thought. Okay, before we get too far, I want to point out that down below in the description box is going to be a link to the Healthcare Advocacy newsletter, a mostly daily newsletter, which is the text for today's video. All of the links and references and links to other stories that I mention are in there, together with all of the actions. Okay, let's get started. Ghost networks. I want to say a big thank you to Jessica Cravens, who writes Chop Wood, Carry Water. She sent this to me and said, you should write about this. So let's do that. Let's remember how commercial medical insurers make money. They sign up as many policyholders as possible. They negotiate low reimbursement rates with doctors and other providers. They deny claims and pre-authorizations based on their own clinical experience instead of medical necessity. It's a long list of activities that they go through designed to bring money in and hold on to it as long as possible while it's invested. Because that's typically what insurance companies do, is they are investment vehicles, and they're doing something else on the side to get the money in so that they can keep it invested and make money. Okay, well, it has come to light that insurers do not always maintain an accurate list of in-network providers in anybody's area. The list may include doctors and other providers long out of business, or inaccurate contact information, or specialties, medical specialties, that are just not offered. Maintaining inaccurate but bulked up lists lets policyholders, us, think that they may have in-network access to a particular doctor or specialty, and it just isn't so. Having alleged long lists of specialists also lets them deny requests to increase reimbursement rates to specialists. I'll talk about that. So you think you're buying coverage and you'll be able to go to a doctor or provider in your network, and they're not available. That sounds just like fraud. They signed you up under false pretenses because they didn't check the lists. You were sold the policy based on the accuracy of the network list, and the providers you counted on may not exist. Well, how big a problem is it? It turns out it's a really big problem. Senator Ron Wyden of Oregon decided to investigate this last year. Here's what he found. He is chairman of the Senate Committee on Finance, and his staff reviewed in-network directories from 12 different insurance plans in 6 states. So they're kind of sampling around. They systematically chose 10 providers from everybody's plan for a total of 120 calls. Of the 120 calls they made, a third were inaccurate, non-working, or just unreturned calls. The staff tried to make appointments. Out of those 120, 18%. They were able to make 18% appointments. That's horrible. A recent Lever, that's a news organ, report investigated United Healthcare's network. Oh, I should point out, these bulked up networks that have invisible providers that are not there, that's called a ghost network. Okay, so they decided to look into this in the Boulder, Colorado area. The reason was that one physical therapist working with United Healthcare had not had an increase in her reimbursement rate for, get this, 25 years. She called them and said, hey, it's about time to increase the reimbursement rate. And they said, oh, no. There are way too many physical therapists in your neighborhood. There is no need for us to give you a reimbursement. We have so many other people that patients can go to. So she said, really? And she looked into it. And it turns out it was a lie. She was pretty much the only one in her area. So they make little effort to ensure that their stated networks are valid, they lure unsuspecting customers into the trap of having a robust network from which to choose, and all too often they find out that it was just bait and switch. And now they've got your money and you're kind of stuck for the year with them. All right, let me point out that there are other nefarious activities they take with respect to their lists. I have a friend who is a medical provider, and she told me that insurance companies would actually drop the reimbursement rate in the middle of a contract year. It's just market forces. Trust me, it's just more BS. Okay, so if you have a health insurance policy that you have to buy, like one through your employer, or an ACA, an Affordable Care Act plan, or if you're in a Medicare Advantage plan, whatever you're buying, it behooves you to check that the practitioners you think you're going to want are in the network. Just take the time and look, because if they're not really there, it means nothing. And when I say take the time and look, it doesn't mean look through the network. It means look through the network and call them up and say, I'm going to have blah, blah, blah insurance. Are you in network for them? And make them answer, okay? And if they're not there, go find another provider. Okay, I want to point something out to you. If we had universal health care, this discussion, we would be talking about something else. Everybody would be covered pretty much, and we wouldn't talk about this. Let's see what we can do to fix this. I've got a sample, I've got a quick action you can take on your cell phone. All you have to do is go to the messaging app and type in SIGN, S-I-G-N, PGCOXI, PGCOXI, SIGN, PGCOXI, and send it to 50409. Here's the email that's going to go to your member of Congress and to your 2 senators. Ready? I'm your constituent, and we all deserve a healthcare system that works for all of us. I just learned that health insurance companies often maintain inaccurate listings of in-network providers. There are so many errors that these are called ghost networks, because the people you think are there are missing. We the consumers are lured into purchasing their health insurance with the goal of having access to those providers. It is a disaster when they're not available. Senator Ron Wyden and the staff of the Senate Finance Committee conducted a study recently. They found that systematically checking the directories of 12 insurance providers in 6 states, they were only able to make 18 appointments 18% of the time, because a third of the providers were unavailable due to inaccuracies or unresponsiveness. Look, this kind of thing is out of bounds with universal health care, but we need help right now. I want you to build legislation that demands that health insurance companies maintain accurate lists of in-network providers and has penalties if they don't. Perhaps you could start by sending a letter to Javier Becerra, Secretary of Health and Human Services, and Chiquita Brooks-LaSure, who's the head of the Center for Medicare and Medicaid Services, to find out what they can do to address the problem for plans over which the federal government has oversight. Thank you. Now wait, there's another action. This is an extra credit action. In the newsletter, there is a link to a website that has the phone number for every insurance commissioner in the United States, all 50 of them. Let's call the commissioner in the state we live in, and ask them to implement an in-network accuracy rule for health insurance policies sold in our state to eliminate these ghost networks. Otherwise, we're just lambs led to slaughter. We are just poor consumers because they need us to be poorly informed consumers. Okay, let's take those actions down below. Like, subscribe, and share. Sign up for the Healthcare Advocacy daily newsletter. Talk to you next time.